Thank you all for joining us. We'll jump in just a moment. In the meantime, you can get ahead of the curve and start entering your name, your city, state, and organization you represent, and we'll have another question we ask in a little bit. Thank you for joining us. Okay, let's begin. Thank you for joining us for the role of school-based health centers in supporting youth capacity for adaptability. Hope your day is going well. We appreciate that you all are joining us and have a lot of great content prepared for you today by our stupendous speakers. Additionally, I want to take a moment to mention that this session will be recorded, and the recording, along with the slides, will be posted on our website and in additional email follow-up. My name is Mandy LeBlanc, and I work as a consultant for the School-Based Health Alliance. Many of you here are familiar with our work, but if you're not, I want to give you a quick overview of who we are. We are a national organization that works to support and advance school-based healthcare. We offer standards to the field, we do data collection, and we provide training, technical assistance, and consultation to support school-based health centers from the planning stage all the way up through expansion and improvement. Before we get started, I have a few reminders. I wanted to review some basic housekeeping. You can hear us, but we cannot hear you. You can use the chat to ask any questions that you might have, and we'll save a portion of the end of the session for questions and answers. If you wish to have closed captioning turned on, there should be a button on your screen that either says CC or closed captioning. We will also have a set of evaluation questions at the end of the webinar that we encourage you to complete, as it helps us to provide the best content and tailor it to the voices of those in the field. Today's learning objectives are that we hope participants will be able to explain the relationship between early childhood experiences and long-term health outcomes, such as physical health, mental health, and social outcomes. Determine how promotive and protective factors can serve as a buffer against stressful experiences to promote overall well-being. And identify at least 3 healing-centered strategies that can be instituted within your health center. I would like to introduce today's speakers. Again, my name is Mandy LeBlanc. I'm based in Seattle, Washington, and I'm happy to represent the School-Based Health Alliance.
Hey everyone, I'm Donnie Grieco. I am an associate here at the School-Based Health Alliance, and I'm coming to you from Pennsylvania. Now I'll pass it over to Jacqueline.
Hi, everyone. Great to have you all here. My name is Dr. Jacqueline Christensen. I am a Senior Vice President working in our Quality Research and Evaluation work here at School-Based Health Alliance. Just a quick note, I am a developmental psychologist. I've been working for over 20 years in community mental health, program evaluation, crisis systems work, and just a lot of work around training individuals about stress and early experiences and well-being and how to help put kids on the best developmental trajectory possible. And I also do research in this area as well. I'll pass it on to Joe.
Welcome, everybody. I'm glad to be here. My name is John Kennedy. I'm a Vice President at School-Based Health Alliance. My focus career-wise has been in behavioral health in a school-based setting and in schools. So I'm really glad that you're here today, and we look forward to how do we take care of kids even better. And so I'll turn it back over to Mandy.
Great. Up next, if everybody could put in the chat, if you haven't already, please put your name, city and state where you work, and your favorite way to engage students who have multiple challenges or need extra support. Thank you.
Okay, then we will get started. I'm excited to see some of your ideas as well in the chat around just what you're bringing to the table from the perspective of, favorite ways to engage students who have multiple challenges or might need extra support. So Donnie put that in the chat, but looking forward to reading some of those. If if I could see all of your hands, I would ask you how many of you are familiar with the Adverse Childhood Experiences Study. You can put that in the chat or not. But when I used to do this training or training with this content, even 15 years ago, there were a number of people who said they hadn't heard of it, right? And I first learned about this research, in probably 2008, 2009, and then really started digging in where a lot of people weren't familiar with it. And then probably by 2014, 2015, so a decade ago, there was definitely more people who had heard of it. So if you are already familiar, great. Then some of what we're talking about today will just build on what you already know. And if it's new to you, then I do encourage you to look it up. So many people will talk now about ACEs. And when we talk about adverse childhood experiences, we're talking about any sort of negative events that happen before the age of 18, right, that can result in overwhelming the stress responses in our body that then have a trickle-down effect to health challenges, social challenges, and economic risks. Now, when the original study was done a while back in the 90s by Dr. Vincent Felitti and Robert Onda, and actually the work started even earlier than that. Dr. Felitti worked in an obesity clinic and found that a number of his female patients who had struggled to make progress had histories of early childhood abuse. And he said, this is really interesting. It's sad, but it's also, there's a pattern emerging and I want to know more. And he reached out to Dr. Onda at the CDC, and then they did that large scale study at Kaiser in the mid 90s. They had over 17,000 patients in their sample, and it was a retrospective. So they basically looked at the charts because they were at Kaiser, and they were able to look at the medical records of 17,000 people, and then they gave them questionnaire. And it was not the 10-item screener that most people are familiar with. It was a much longer questionnaire about their early childhood experiences. And then they looked at the data, and they found that the more negative experiences that the patient had reported early in life, so before the age of 18, they were more likely to have health problems, including asthma, heart disease, substance use, and even cancer. I have met Dr. Felitti. I've had dinner with him. We joke that it is probably one of the biggest no-duh studies that was ever done, because the results are perfect graphs. Like, yes, the more adversity early on, the more health risks they were seeing. People have then been researching this topic for the past 30 years since they did that groundbreaking study. And it took a while to get it really into the popular vernacular. He wanted more pediatricians, more doctors to talk about it, and they didn't want to because they were very afraid of opening Pandora's box. But people started talking about it more. And so the expanded model that you see there on the outside started looking at other factors beyond those 10 that were sort of pulled out as the most predictive. So people started looking at the environment, the neighborhood, bullying, systemic issues. And so that's really where the research went. At the same time, and when I first saw him present, again, I was either 2009, 2010, I asked him the question. I said, what about protective factors? Where does that come into play? And he said, you know what? I don't know. We haven't done that research. But people have done that research since then. So next slide. So what we know now that he did not know then, though I'm sure he had a hunch, was that we can buffer against those negative experiences. And in fact, it's not a linear trajectory. And we know that. We ask ourselves, some kids go one way, some kids go another way. What's happening, right? There's no common trajectory. And a big piece of that is what we call protective and compensatory experiences. So people have liked to give a parallel to ACEs, which are PACEs, which are the countering events or circumstances to mitigate or buffer against those negative experiences, right? So we want to say, okay, if we're going to really be looking at a child, we don't want to just say, what are all the negative things that have happened? We also want to be looking at what are the positive things? Again, it's like a scale. We really want to be saying, what's going to help support this child and buffer against some of those things that might be happening? And this is connected to, again, a sort of broader umbrella, which is just positive childhood experiences, right? Just looking at the interactions and environment to promote well-being. What you see on the colorful side of the screen comes from the protective factors framework. Again, there are a lot of resources online that you could find if you just Google protective factors framework. But they've identified sort of these 5 big buckets of protective factors, right? Really looking at what is the parental capacity to bounce back and support their kid? What social connections does this child have? Are there concrete supports? So again, looking at resources available to that child. What knowledge does the caregivers have about parenting and child development is a really critical one, and a lot of pediatricians try to infuse a bunch of that in there as much as they can. Folks who do the ages and stages early on will try to use that as a tool, right? If we're looking at early childhood, but even by the time you're getting to elementary, middle, and high school, there are still ways that our healthcare system can provide some of that parenting and child development knowledge so they know what's typical, so they know how to respond. And then, of course, social and emotional competence of the children themselves. Right. And so that's some of what we'll talk about a little bit today, but that's often what we think of, right? When we're thinking about some of, like, well, what can we do with the kids? Well, we're going to infuse, a lot of social emotional learning with them, which is great, but you need all 5 of these, right, to really wrap around that kid. Next slide. So I'm going to give you an upside down version of the ACEs pyramid, because the reason that Dr. Filiti and Robert Anda made it into a pyramid initially was because they were trying to show that stressful events can happen to lots of people, but not all of them work their way up the pyramid. People fall off, right? And that's actually a good thing. Right. So the top of that pyramid, or here, the bottom of this pyramid, says early death, and people go, oh, how dramatic. I say, yes, for a small subset of people, that can happen. But that's not actually the majority of people, right? And we say, well, how do people fall off? Why do they fall off? Well, it's because of those promotive and protective factors. Again, if this is an area of interest to you, I do recommend the Hawaii longitudinal study. It was a great longitudinal study about what tends to fall off, or not what, how many people tend to end up doing okay despite what happens early on, right? And you're actually looking at about a third will work their way farther down the pyramid than others, right? So the other piece that some of the early versions of the pyramid didn't really spell out well is they said, between the stressful early childhood experiences, environment, and individual differences, and the negative impacts on brain development, epigenetics, immune system, social skills, and behavior, was they put little arrows that said scientific gaps. We don't know how this works. 30 years of research later, we absolutely do know how this works, and there is lots of research out there. And so what I've added there is toxic stress, and I'm going to talk more about that. So then, to walk you through this pyramid, what we're seeing is there can be negative experiences that happen early in childhood. They can happen directly to the child, or it can be part of that child's environment. There can also be individual differences that child is just born into the world, right? So I gave an example in a recent webinar about my daughter was born with auditory sensitivity. She came into the world sensitive to sound and some visual sensitivity. And that makes it so that she's more likely to experience toxic stress or a stress response for certain types of input that she gets, right? So she was just born that way. So you have things that happen to you, the environment you live in, and just who you're born as, right? And for many children, a repeated exposure to these things can result in what we call toxic stress, which is where your body's nervous system is overwhelmed and your body is going into stress responses too often, too frequently, or you're not bouncing back. That is where we get the wear and tear on the brain. We get epigenetic impacts where it's changing what's happening in your genes. Impact on your immune system. You hear a lot about cortisol. We like to joke that cortisol needs a new PR agent because cortisol in and of itself is not a bad thing. Cortisol is great. We all need cortisol. It helps tamp down our adrenal response, but too much of it sitting there is actually not great, right? So that's what's giving that immune system response, as well as, again, when you're in a stress response, it makes it hard to learn. It makes it hard to engage and connect with other people. It comes out as negative or challenging behavior, okay? But again, the purple buffers come in here, the positive relationships, the goodness of fit. You find parents who can support, and then we see that things can go a little bit better. And some kids get off this train. They're cool. They grow up to be well-adjusted adults, right? But then for some kids, it's not quite enough. They engage in some risk behaviors, maybe substance use, other, dangerous or unsafe behaviors. And again, are there positive factors to intervene, put them on a trajectory where they end up integrating well into society, or does it lead to chronic health problems? So that's that trajectory, right? And so I think the important takeaway is to say, where do you fit in here to help kids get off this train, right? Where can you be part of the purple in this visual to help pull them into a positive trajectory the best you can, right? But know that it's not just up to you. There's a lot of factors, but even one support can make a huge difference, right? It's not really all or nothing. Next slide. So I talked about toxic stress, and I do think it's worth defining for you a little bit further. So again, when we're talking about looking at what's happening in the body, we do want to be assessing sleep, because without good sleep, we do not have a healthy sleep-wake cycle. And that means your body will probably be dysregulated quite a bit. And that goes for ourselves. If you ask yourself, how has your sleep been, right? Do you have a easy or hard time focusing if you have not been able to sleep? We also want to think about looking at what I mean when I say a stress response. I mean that your body is in fight, flight, freeze. You are getting increased heart rate if it's going up, or you're zoning out and spacing out, right? There's different ways you can be going into a stress response. All of us are meant to go into stress responses. They're healthy, they're adaptive, right? So if, somebody jumps out at you and you go, "Wah!" Like, that's a good thing. You don't want to just stand there, right? If you hear a noise, you run. That's a biological imperative. What we want to be mindful of is that if you see a kid who is experiencing these stress responses all the time, every time they come into the clinic, every time you see them, or they last for a really long time, you're talking to a parent who says, yeah, when they get this way, they stay that way for 20 minutes, 30 minutes, an hour, right? You have kids that are struggling and being taken out of class because they're not able to get back to that calm state. If they continue to go into a stress response, let's say they're new to the school, or they really struggle between recess and lunch, right? Or getting back to class, that's when you see them, quote, act out. That's when we say, okay, well, have they habituated, or does this continue to be an issue? And that's where you say, okay, what's happening to put this kid into a stress response at every one of these occasions? And then, do you ever see this kid in a calm alert state, or are they just always in a stress response, right? So that's what we mean by toxic stress, and that's operationalized. That's based on the work of Connie Lillis and Janice Turnbull through something called the Neurorelational Framework. It's also based on the work of Dr. Bruce McEwen, who has done a lot of research on stress patterns. What we are looking for is good quality sleep and encouraging good quality sleep, a calm alert state. Now, we can't be calm alert all the time. We call this green zone. If you were green zone all the time, you'd look a little creepy, kind of Stepford wives. You just smiling all the time, right? It's okay. We can have a full range, right? Some of you right now might be going what we call a little bit blue zone. Maybe you're staring into an abyss. Come back, right? Are you, wiggle your body, get back to green, right? It's okay to leave and come back. That's healthy. It's adaptive. It's hard to be engaged consistently for a long time. but we want to be mindful of those patterns. So this is what we call self-regulation at the end of the day, but it's that ability to experience a stress response and then come back, right? We can come back, we can be what we call green and alert. Next slide. So to really hit that home, actually, can you go back one more, Donnie? I'm sorry. I realize one of the things that I really want to hit home here is that when you're under stress, you're not learning, right? So as we're thinking about how this impacts the kids in schools, learning's not going to happen. You're going to see those physical and mental health challenges. When we do experience calm alert state, we can learn, right? That's an engaged student in a classroom. That's someone who can talk to you and communicate with you. And that's really what we're looking at, because if we can identify those stress patterns, that's really the difference between, that's where we catch them before it starts to impact all of those trickle down things on that pyramid that we saw. Now, again, you might be getting an adolescence and say, is it too late? No, you can still think about the stress response patterns. You can think about your own. You could think about their parents, right? It's not limited just to childhood. Okay, thank you, Donnie. Next slide. So now I want to take a moment before I get into this, and then I'm gonna be transitioning soon over to John. Again, I know I can't see you, but how many of you have seen dandelions? I hope it's all of you, maybe most of you. How many of you have seen where they grow? Put in the chat, where's the weirdest place you've ever seen a dandelion grow? I've seen them grow out the side of buildings. I've seen them grow in concrete. I've seen them grow. Yeah, they grow all over my yard. They grow all over my yard too. Cement, right? Cracks of concrete. And how many of you have tried to get rid of the dandelions? Has anyone been successful? No, just give it up. This just not worth the effort. Oh, you have? You were successful? We'll talk later. No, we keep them for the bees. But no, Christina says, no, never mind. I was not successful. So dandelions grow everywhere, all the time. And there's nothing you can do to stop them. It doesn't matter what happens. You can spray pesticide on them. You can cover them with concrete. You can do all sorts of things, and they will pop right back up. And not just one, like 5 of them or 10 of them or 100 of them, right? Now, let's switch gears. How many of you have tried to take care of an orchid? Currently babysitting my brothers, and it's making me really nervous. How easy is it to grow an orchid? Not so easy. It takes a lot of specific things. I once had an orchid. I don't even like the plants. People give them to me. I'm like, I don't want them. But one of them needed to be watered with yes, so hard to get it to reflower. I don't even understand the trimming. Yes, they're so finicky. One of them said to put an ice cube on top to get it to grow, to like water it. There's a continuum here. Hopefully you see where I'm going with this. This is based on the biological sensitivity to context theory, but it basically says kids are on a continuum. Our bodies, our nervous system, our stress responses, who we are, exists on this continuum from dandelions to orchids. That's what I was talking about with individual differences, right? And so when we come into the world, when we meet a kid, think of some kids you work with. Would you put them more in the dandelion category or the orchid category, right? You have some kids, they just bounce back no matter what happens, right? This happened, that was okay. I did this, then I did this, and it was fine, right? And then you have kids who one thing happens and they crumble. World falls apart, right? And we want to be able to address and hold space for that full continuum of kids. And I don't think it's an either or. Absolutely, there are kids that fall in the middle. One thing I will say though, when they started looking at some of this early research, they found that for the dandelions, the protective factors didn't actually make as much of a difference because it kind of didn't matter. They were going to continue just on a trajectory. But for the ones who had more orchid-like features, who were a little more sensitive, who had more stress sensitivity, they tend to blossom more with the right protective factors, right? So whereas the negative things can be more detrimental to them, positive things flower all over, right? Flowers everywhere. So what we want to think about is we're thinking about kids' adaptability, right? As we think about, is it something that they're born into the world with or something that we can help shape? It's a both and is what we call transactional, right? And there's some controversy over this theory as well to say, well, is it just predestined? No, it's not. But we do know that there are epigenetic factors that can make a difference and individual factors that can make a difference. That being said, we want to think about this adaptability and this capacity that kids have, right? It's a process that they can positively adapt, right? Even in the context of adversity. We like to think that every child, every person comes with this capacity to spring back, rebound, right? Bounce back in the face of adversity and develop social, academic, and vocational, sorry, swallowing funny there, and vocational competence despite exposure to severe stress. Okay. So with that, I'm going to turn this over to John, who will help us think about what this means at an individual level, but then also thinking more broadly than that, because I think one of the things that is really important is that some of this is about the kids themselves, and some of this is about the environment, the situation, the relationships, right? So it's a both, right? As we're thinking about how we help kids become more adaptable. It's bigger than just, well, they need grit. I mean, grit's lovely and it's an important concept, but it's bigger than that. So take it away, John.
Thank you, Jacqueline. So as healthcare providers in school-based health centers, we are really uniquely positioned to support students' overall well-being, their overall well-being. Our role really is not only to address the physical and the mental health concerns, but really to help students build that capacity in order to thrive despite the challenges that they face at home or in the community. So let's explore how we can promote thriving through both individual support, as Jacqueline said, but also through creating that nurturing school environment. So as a clinician, there's no way to implement everything that you're going to hear in these next two slides overnight. So as we go through the slides, write down what suggestions for you seem to be an easy lift, as it may already be a part of your personality or your strength. And also, there's going to be things that we talk about that you already know. The key here really is how to be intentional in implementing what you hear today. So let's go ahead and start talking about those personal level factors. How do we build that inner strength within students? One of the first ways we think about this is in terms of social competence. And that's really the ability of students to effectively interact and build relationships with peers and adults. And if you think about how much of our daily life and students' daily life is really about that interaction. So anything we can do to support that, we're really helping them in the daily walk of being a student and a young person. Some of the key components that we want to really emphasize here is empathy and compassion. How do we teach students to recognize and respect the feelings of others? Just think about so many behavioral problems that teachers see as really about a function that students really don't know how to recognize other people's feelings and thoughts. And so the more that we can incorporate that social emotional learning into our health centers, we can help students by helping them practice empathy and developing those meaningful relationships. We want to work on improving the regulatory capacity Students, we need to help students manage their emotions and their reactions because it greatly impacts. So things we can do to help that is to introduce breathing exercises, teaching them grounding techniques, teaching them coping skills to help them regulate their emotions during those stressful situations is very valuable. When we think about communication skills, we need to help train them to express their feelings and their needs effectively, because that's sometimes a very hard skill to learn. Even as adults, we struggle with that sometimes. So how do we do that? Even in whether you're behavioral health or primary care, you can do that on those one-on-one sessions, really to help students develop assertiveness and how do we be better listeners. Thinking about problem solving and mastery. We want students to have the ability to approach their challenges logically, and we want them to develop practical solutions. How do we do that? Really work on building their self-efficacy. So helping students believe in their ability to overcome challenges is so important. If we can boost an individual's self-efficacy, we can do that by simply acknowledging the small successes that we see, even the ones that are taking place in a routine visit to the health center, or if it's in a counseling session. But helping them see that they do have the ability to overcome challenges is really important. Thinking about critical thinking, how do we encourage students to be thoughtful in the decision making? We can do that by using the real life scenarios that our patients or our students present to us, helping them to think about it and practice analyzing those situations and then saying, what are the possible solutions? As we do that, every time we do that, we're helping them to think critically. Resourcefulness, that should be an easy lift for us, teaching students how to use and access the resources that are available. And there's a lot of resources. We just have to be, I think, intentional in making sure that we provide this information to students. Guide students in how to find the support, not only in the school, which there's a lot, but in the community, where there's other services that they may need, even through peer support groups. Peer-to-peer support is really a way that we learn a lot because we're learning from our peers. When we think about autonomy, we're talking about fostering students' ability to make independent and responsible choices. How do we do that? There's two main components to that. The first is, how do we help them grow their internal locus of control? We want to empower students to feel that they are in control of their own lives. And for many kids, we know that they do not have the hope, they do not have that belief. And so what do? We can encourage even simple things such as goal setting within a health session in order to build a sense of self-efficacy and internal locus of control. Humor and mindfulness are always good standbys when we're working with students, incorporating that lightheartedness and presence into the daily routine, teaching students simple mindfulness practices that help them stay grounded, particularly when you think about how could they implement them when right before that exam or that high pressure situation that they're in many times in schools. Things like, managing their breathing or body scans. If we help them focus on the present moment, it really helps center them. I really strongly advocate for helping students get a sense of purpose, because we all want to know what our purpose is in life. And a sense of purpose is so helpful in not only students, but all of us finding meaning and what motivates us in life. So some of the things that we can do to support that is really think about belonging and motivation. We need to encourage students to feel valued and a part of the community. Help students identify their strengths. What are their strengths? What are their interests? And guide them into opportunities, whether it's clubs or activities, because that will help them have a sense of purpose. Altruism and connection. How do we promote acts of kindness and community service? We know that so often when we take our eyes off ourselves and put it on to others, that really makes a difference in how we see the world. So let's encourage participation in different programs or other community services that really foster that sense of belonging. We want kids to see themselves as something bigger than themselves. So let's take a look at the environmental level factors. How do we create that supportive school environment? Number one is caring relationships, and we know the power of them. We are talking about consistent, compassionate supports from adults and even peers. And in the school-based health center, our relationships with students should be built on trust and non-judgmental. Letting students know that they're cared for, whether it's through a warm greeting or the safe space that we create to express their feelings. So building that partnership with those other adults in the school is really important, because we know one of the biggest or the strongest protective factor is one caring adult. And so often that school-based person can be that caring adult. We need to set high expectations. Setting clear and positive expectations for students really enhances their abilities of themselves. So when we know that we believe in their potential, it motivates them to really live up to those expectations. So try setting achievable health goals and celebrate the progress, even in those in the clinic visits that you have. Here's a side note that always I just want to make. So often we participate in professional development and we apply it to our work, we apply it to our career. But there's just so much in this webinar and even in other webinars that others should and can be applying to other areas in their life. Setting high expectations, let's be honest, is just good parenting. You know, most children strive for the bar, but if the bar is low, are we doing them a disservice? So just think about setting those expectations. An example of how some health centers, you know, in goal setting during health check-ins, let's see if you can decrease your sugary drinks in over the next several weeks by 2 drinks, 2 less sugary drinks, and 4 more bottles of water. And then when they're able to do that, recognize that and celebrate that. How do we provide those opportunities to contribute and participate? Giving students that chance to feel valued through involvement really is a strong impact in them. How do we do that? We can create some volunteer activities or opportunities within health centers that we can have students feel like they're contributing. And when they do that, it builds their self-worth. Sometimes school-based health centers have advisory boards, giving them a voice in the decision-making that affects their well-being. We're really offering them participation. And I just want to close thinking about the power of a mindset. So we do not have to be defined by our negative experiences. Reframe the challenges when we meet these students, reframe the challenges as opportunities for growth. Help students see that some of the setbacks that we go through in our journey is just that rather than the end of the journey. I want to offer a call to action for our healthcare providers. Let's use your position as trusted adults to model growth-focused behaviors and really support students in building their own capacity to thrive. By focusing both not only on growth and supportive environment, we can empower students to move beyond their challenges and build fulfilling lives. Okay, so what can the school-based health centers do? First of all, let's start with safety. Safety is critical in the school setting where students may feel very vulnerable. And we know that for some, students thrive in the school. Others, they struggle to come to school for many different reasons. So if we can create that environment that gives them a sense of safety, we really encourage then our relationship to continue and to grow. You know, greet students by their name. Make sure that you're smiling, because that first impression really establishes an immediate sense of trust and safety. When we think about what else we can do, think about ourselves and being calm and being attentive to those students. So often students come in and they're feeling anxious or they're overwhelmed. And how do we establish a calm feeling with them first is really essential. So before the conversation even starts, really model that calm behavior, because we know that they're reading our cues. Having that shared sense of experience and joy, we want to engage students by integrating familiar and comforting sensory elements. For example, you know, having the school mascot or motivational posters in that space really helps them to relate and make students comfortable sometimes. Using the soft lighting and the calming colors. Anything we can do to really have that sensory experience that brings in that calmness is a powerful intervention. Self-awareness and stress response. This is key because it's important that we recognize our own stress levels. And often we know that students will pick up on the adult emotions. We know that as parents, we know that. And so if you're feeling stressed, and take a minute to pause and center yourself, because that student is going to read what you're giving off. And so just a quick mindfulness exercise or a grounding technique for yourself really then helps students engage with you. Let's be a source of co-regulation. Students often reflect, and we talked briefly about this, the emotional state that the adult is carrying into that space. And so when the student is visibly distressed, you know, us speaking in a calm and a slow voice really helps to reduce their stress level. Keep that eye contact, and maybe instead of standing over them, you know, sit down in a chair beside them to minimize that intimidation factor. Active listening with empathy and without judgment. I think this is a big one when we're talking about youth today, because there's judgments all around them. Peers are making judgments, adults are making judgments. And when we can listen deeply without judgment, I think it really encourages students to open up. So we use phrases like, I hear you, I'm here to support you, acknowledging their feelings without minimizing that. And sometimes that's hard because adults don't want to hear about, you know, what students or younger people are feeling. So avoid making those assumptions and let students express themselves fully, because what you're doing is you're building that environment where they trust you. We have a lot of differences within our student population, different backgrounds, cultures, personal experience. Take that into mind. Be mindful that perhaps their past experiences really impacts how they are living life, and respect those personal boundaries, especially when you start discussing those very sensitive topics, but be sensitive in your communication. So how can we make this space an approach more supportive? What we want to do is transform the health center space into a safe space and welcoming. And we talked about the posters, the messaging that's within our waiting room, student artwork. All these really help to create that environment. So what else can the health center do? What we want to do is we want to shift the conversation framework. And this is so important, folks. We need to go from what's wrong with you to what happened to you. And this is powerful. Think about a grocery store for a minute. I think that's the best place to find examples of bad parenting. We have all seen it. And we often feel so bad for those children. And we ask ourselves, what's wrong with that parent? Why are they doing that? And yet we don't know all the challenges that that person is dealing with at that point in their life. And yet we make judgments. And so, plus, most of us know that you don't take hungry kids to the grocery store because they want all of that. So, instead of asking that student who's acting out, why are you behaving this way? Ask, what's going on lately that might make things difficult for you? That really changes the conversation of my behavior to what's bothering me, what's irritating me. And through this approach, we build trust and we build upon that relationship. It's important that we look upstream. And as we get to know these students, we know sometimes what the root causes are. But we have to understand that those behaviors and health needs often have deeper roots related to their life experience. And so please keep that in mind. The student who frequently misses school might not just be disinterested in academics, but maybe they're facing housing and instability or food insecurity and have a host of other issues. So addressing the root cause is important. So let's consider the whole child. There are a lot of ways that and good screening tools that we can make good assessments that are provided out there. Tools such as the social influences on health, whether it's Prepare or the iHelp, we know today that there's a lot of work being done with making sure that these type of instruments connect and integrate with the EHRs, because then we're able to track them and make referrals. We have great mental health screenings that different providers use, whether it's the PHQ-2 and 9 or for depression, or the GAD-7 for anxiety. The risk assessment, we have school-based health centers that use the ACEs questionnaire. And how they use that is they take it and they laminate the 10 questions and they share that with the age-appropriate student. And they say, I'm going to step out and I would like you just to take account of the number of the 10 questions that you say yes to. And then just write that on the bottom of that laminated. I don't want to know which ones, but then when you come back in, you can see just what their score is, and that can go into the EHR and you can monitor that, but it also gives you that starting point for that conversation. So often we're problem focused, but really we need to be strength-based focused. There's a lot of good instruments that are used, and so keep those in mind. We have care coordination. So when we're really talking about how do we help students, that family voice and choice is just so important. And maybe they can't be there, but you can give them a call on the phone, invite them to participate. And then, of course, when we do referrals, we got to make sure we close the loop. And I think we're getting better at this because we're recognizing we give a lot of referrals, but what happens either on the referral side or the parent side, they just don't have the capacity to complete them. So let me just walk through this real quick scenario of Janice, who's an 8th grader. And well, you can read that for yourself. So what steps could you take or could we take to reflect on our own feelings and frustration? Because Janice could be very frustrating. So we could recognize our frustration and we can go through those steps. Why is Janice frustrating me? And really begin to ask yourself that. We can use those self-reflective techniques. We can practice that mindfulness when we know Janice is coming. I need to take a minute and just get in the right frame of mind. What are some things that I might want to ask or notice in order to provide better support for Janice? One of the things is make sure we understand the behavioral cues. Realizing that Janice's loud talk or that snappy behavior is probably a response to stress. And instead of reacting to her mood, the changes, pause and consider, what are the external factors or this instability? Maybe it's the family instability, family stress, but what could be impacting her mood? And then shift the question. Why do you keep, instead of saying to her, why do you keep coming down here to the health center? What's been on your mind lately? There's that opportunity to create that safe space and really demonstrate that the school-based health center is that place for consistent, safe support. Building trust and safety, again, being predictable and positive with our interactions, being very genuine in our curiosity, because students know when we're there and when we're actively participating. Don't forget, maybe you just need to reassess the whole child. And absolutely do not forget the family. So let me go to slide 16. And in summary, this slide, I want to read it to you. The capacity to thrive does not come from rare and special qualities, but from everyday magic of ordinary, normative human resources in the minds, brains, and bodies of children, in their families, and in the relationships in and their communities. The capacity to thrive is not rare. What we have to do is do our part. And the everyday magic, we can be a part of that. The things that we share with the students can really be impactful in their life. That supportive adult is so important. And you could be the very one that makes a difference in that child's life. So the takeaway, I want us to remember to focus on nurturing and amplifying the strengths that exist within each child by building those supportive relationships and connecting them with the resources that we have available to us, and then helping them see their own strengths. This everyday magic can empower students to overcome challenges and thrive in life, and you are a part of that.
Thank you, John. Way to wrap it up. We can start putting questions and answers in the chat, and we will also start to post the poll. We appreciate hearing your feedback so we know how we did and how we can focus on continuous improvement. We'll leave that poll up for a few minutes while I cover some ways to find more information about our upcoming webinars and our previous webinars. Also, a reminder to save the date for our national conference that's coming up June 29th through July 1st. And some ways to follow us on social media to learn about upcoming webinars. And now we can open up for questions. Feel free to put those in the chat while you answer your closing poll. Thank you. We'll give the poll another 1 minute. And I'll ask our presenters a question, as I don't see one in the chat yet, but what would you say are some common obstacles to implementing healing-centered approaches in school-based health centers, and how can we overcome them?
I can take a crack and John can chime in. I think one of the biggest obstacles is just getting everybody on the same page. So finding that common language, not just because when we're thinking school-based health centers, right? There's such a unique situation where you have the sponsoring organization, the health center that is, they have their own language, the way they talk about things. Then you have the school, and the school has the way they talk about things. And so you're at this intersection, right? And so to be able to get everybody on the same page, using the same words, having the same mindset I would say that's probably one of the biggest challenges, because you have some people who are sort of stuck in the compliance, non-compliance, follow the rules. If they act this way, then this happens, right? You have some people who still, think that way. And then you have people who are much more in the healing centered engagement space, who are very much about how do we create supports, how do we make enhancements to this child's environment, how do we see the positives, and sort of everything in between. And so I think a big piece of it comes down to the leadership and having buy-in from the leadership on both sides, and just having conversations and agreements about, hey, if you have a kid who's, yelling in class and throws a pen, what are we going to do? Let's make sure we're all on the same page, that when it trickles down from the school to the health center, or vice versa, from the health center back to the school, that people feel like they can share ideas, and that the leadership is behind that the supervisors are behind it, and then that everyone from the school nurse to the school counselor to the nurse, the primary care provider or nurse practitioner, to the front desk staff, right, is everybody on the same page, so that the message you give to the students and the parents is uniform. I would say that's probably one of the biggest challenges and requires a lot of coordination.
Great. And we just got another question in the Q&A chat from Sally Lemke. How can admin and managers support school-based health center staff around the things that they bring to their own work, from their work, right? So I think, John, you were alluding to how you get into a good place and stay centered throughout your day.
Yeah, would you repeat that, Mandy, please?
Sure. How can admin or managers support school-based health center staff around their own things that they're bringing to work?
I think it's important that we be intentional, because we get caught up so often in meeting students' needs and all the hustle and bustle of what goes on in a school-based health center. I think we need to stop and say, what is an easy lift? What are the things we can do that are not going to cost a lot or are a heavy lift, and begin to implement them. And then part of that question too is, how do we take care of our providers? Because they're in the midst every day of hearing very challenging stories. And so in making sure that they've got the support that they need, whatever that may look like, it may look like different to different school-based health centers, but really paying attention to the health of our providers, and creating that space where they want to come to work every day. That just as they are trying to help students feel loved and cared for, staff have to feel that too from those around them.
Great. And I see a comment in the chat about having a calming space that is very helpful for students. And I've also seen it implemented where there's a calming space at the workplace where you can recharge a bit when our own blood pressure gets a little escalated. We can just go either proactively or when we need to reset.
Yeah. And I'll just add that if you take that same approach, because it's all parallel to thinking, okay, how's the sleep? How's the stress responses for this kid, this parent, for the staff as well? I've done trainings for staff, I did a group for Head Start providers, right? And it was, how are they using a combination, the common language as well amongst themselves to check in and say, you know what, I'm not green right now. I need to take a break, right? Being able to sense your own stress response for, oh, every time the student comes in, I notice that I just start zoning out. What's up with that, right? So another piece, especially in, if you do have a good structure for this, reflective supervision can be a really important element. Again, if you're not familiar with that, you can look it up. Mary Claire Heffron has done a lot of work around reflective supervision. And it's really just giving space as part of supervision to say, hey, I wonder about that, right? It's not full therapy. It's not that at all, but it asks sort of just about, allows us to take like a meta view of our reactions to things or our own stress responses, and just give space for that. So it's not, you know, operations and work stuff all the time, but there's a little more space.
Great. Thank you to everybody for joining us today. And keep an eye out for the recordings. We'll be sending those out soon. Thank you. And thank
Thanks,
you to
everyone.
our wonderful presenters.